We're talking to Laura Purdy, who's an Army veteran, did 14 years, got her MD through the military system. She was a family medicine physician for the Army. She's now engaged in a process called telemedicine manager with something called MD Integrations. Tell us about MD Integrations.
Absolutely. So MD Integrations, you've heard me talk a little bit about if we do it right? If we do it right from a technology perspective, from a staffing perspective, because telemedicine is new and also telemedicine is exploding and growing exponentially. From a business perspective, the companies that are trying to operate within the telehealth industry have a couple of problems that they run into. One is the efficiency of their technology, and two is their ability to staff it from a doctor's level. And so MD Integrations it's a telehealth platform for companies to use that want to become telehealth companies. So if you wanted to start a men's health company tomorrow, you could use MD Integrations and you'd never have to hire a doctor, you'd never have to write a medical policy, and you wouldn't have to design your own technology because we do all that for you.
Yeah, it's a whole back office, backbone sort of approach. Yeah. Its website is mdintegrations.com. If somebody wants to know more about what this is kind of all about and maybe where telehealth is going into the future. I think one of the things we're all wondering about too in this area, maybe, Laura, is patient security, right? So are my visits secure? Are my records secure? Can you talk to that as a little bit? Because it seems to me it might be a restrictor on adoption further if people don't feel secure about using the technology.
Yes, and that is a question that is received quite often. But the great thing about electronic medical records is that electronic medical records that are in the hospital have the same sort of technical safeguards that allow for information privacy and security that internet-based electronic medical records do. For example, there are a lot of hurdles that have to be jumped through in order to make sure that the data privacy laws and the HIPAA, the healthcare information privacy laws in the United States, are adhered to. And there are rigorous testing standards. So in order to even qualify to transmit an electronic prescription, it's about a year-long process with several steps in the quality assurance process before any given company can even get permission to be able to send one prescription, because they take security so seriously. And there are several levels of security testing that have to be passed, and certifications such as LegitScript, SureScript, and HITRUST. Those are just a few certifications that these websites can get. So if you're a consumer of telehealth and you're going to a website, scroll down to the bottom of the page. These companies will post their certifications so that you can know that your healthcare information is kept private.
Well, that's important to everybody, and again, on everybody's mind. And I think certainly the maybe middle-aged and up consumers in particular are like, well, wait a minute, I've heard some stories. I do think that there's probably a quicker adoption with folks who grew up with a smartphone in their hand from cradle. But it's really still an exploding or growing industry, isn't it, Laura?
Yes.
Where do you think it's going to be in 5 years?
Listen to this full episode and more on the Apple Podcasts app, Blog Talk Radio, Google Podcasts, or iHeartRadio. And now streaming on Amazon Music, Audible, and Spotify.